Okay.
Okay,
Can we begin to show our presentation, our slide deck, which I'm happy we've all agreed we'll share that with your organization after this evening's over. If anybody wants it, we have some resources at the very end.
that's fine. Who needs to
So-
have co-host ability? Just
Steph Har, and she is doing the work that needs to be done. We just need to move forward to the beginning of the deck, and we will get there soon.
There we go.
all right. So this is Project Aware. So Tracy, I'll let you just sort of introduce your program here to get started, and then go right into it.
Thank you, sir. So we are from the School District of La Crosse, and we're representing Project Aware. My name is Tracy Caravella. I'm the grant coordinator. Everybody will take a minute and share a little bit about themselves when they speak. Next to me is actually Stephanie Har, our family engagement coordinator. Next to Steph is Barbara Eisenmenger, one of our student family assistance program providers. And next to Barbara is Tara Allert, our other student family assistance program provider. And next slide, please. Thank you. So tonight's agenda is we're going to begin with a few teen mental health statistics. We're going to share an overview of Project Aware. We're going to share the goals of Project Aware, and then we're going to take turns diving with more depth into each goal. And then, as I shared, we have some resources for you all that just take you to websites. We have all agreed, if you're all comfortable, given that there are 4 of us, if people would like to ask questions along the way rather than wait till the very end, we are very comfortable with that. So if somebody has a question, and if you want to just sort of raise your hand, or if you want to, put your little notice on, or put it in the chat, I think we will manage any and all of that. You'd actually prefer a discussion rather than just a monologue. So, and with that, now, are people here familiar with the YRBS, the Youth Risk Behavior Survey from our CDC, Centers for Disease Control and Prevention? These are statistics from 2019. If you are familiar, you might know that the YRBS is completed in Wisconsin every couple of years. And although the 2021 survey has been completed, the data has not been shared yet. And we have been told that any day now we will get that data for 2021. So what you see here is that with over 3,000 students for La Crosse County being surveyed. So again, this is La Crosse County data, not our school district, but you see that anxiety is being self-reported at nearly 50% of students. And you see that depression, feelings of depression are being reported at nearly 30% of our students. Now, as you may, given your organization, you probably are very aware that we've been hearing over the last couple of years that this data was reported in 2019. This is pre-pandemic data, and we're expecting those numbers to only rise. And so, Steph, next slide. This comes from the trauma and adversity portion of the Youth Risk Behavior Survey. And so again, of those just over 3,000 students for La Crosse County and high school students, 20% had self-reported that they'd experienced either a rape, a sexual assault, or intimate partner violence. 33% lived in 4 or more residents in their lifetime. 24% have experienced food insecurity within the past 30 days. Again, this is pre-pandemic data, and 84% of the students who identified as having mental health concerns expressed a lack of school belonging. So enter Project AWARE, which began in 2019. AWARE stands for Advancing Wellness and Resiliency in Education. AWARE is funded through SAMSHA. Are folks familiar with SAMSHA, the organization? I would imagine some of you are. If you aren't, SAMHSA is to substance use and abuse and mental health as the CDC is to chronic and infectious disease. So SAMHSA is our big government agency that is housed with trying to address mental health issues. Our grant is a 5-year grant. It's approximately $2.5 million. The purpose, very simply put, is to raise the quality of mental health promotion, prevention, intervention, and services from pre-kindergarten through 12th grade. That's just what we're supposed to do over the next 5 years. Our Project AWARE goals, the very first one is increase and improve the capacity of schools to respond to on-site mental health crises. Second goal, Steph Hart will be talking to you about that one, youth and family voice, increase and improve youth and family authentic engagement. The third goal is to increase our cross-system collaboration to improve mental health supports. Barbara and Tara will be sharing about our student family assistance program for goal 3, and then improve access and engagement to mental health wellness resources. And now we'll dive into goal 1. Any questions so far? I know I've just shared an awful lot of information.
When did your
sir.
grant start?
In 2019, in the fall, August of 2019. Technically, the grant was obtained in April of 2019. Work did not really begin though until the summer of 2019. And the grant was written by Ami Zabrowski and Kurt Taff, who I believe you've seen present this year.
We did. Thank you.
Yeah, you bet. Any other questions? Great question. Not at this time. Okay, so for goal 1, what we would like to highlight is the different trainings that have been going on in the district since 2019 when AWARE began here. We've had NASP, our National School Psychologists Association organization, has put out 2 national trainings, one on comprehensive school safety planning. That training actually took place throughout the district in August of 2019. And then you will see at the very bottom of this list, another NASP training, which is in the future. It's going to be next spring, and that is Prepare 2. That specifically deals with mental health crisis interventions. Does anybody have any questions about this information? This might be maybe not the most interesting information.
This is Helen. I have a question. Is the training specific to certain people within the district, or is it an attempt to train every teacher, every employee in the district?
Helen, great question. Each of those trainings was specific to certain groups of people. So for example, maybe Steph, you could go back to that slide.
Sure.
The first Prepare training was every school in the district had put together a team from their building to attend the Prepare 1 training. Prepare 2 is going to be focused on our student services population staff members. So each of the trainings that you see had a different audience of focus. Any other questions? Okay. We will move on to goal 2. Steph, take it away.
So, hi, I'm Stephanie Haar. I am the Family Engagement Coordinator with the Project Aware grant for the school district. And my job was being tasked with increasing our youth and family voices in an authentic manner through the district. So we started last school year was my first year with the district. And we started with some roundtable groups where we had people who perhaps have been underrepresented in our community, in our district, and talk to them about what the school district was doing and what we could improve on, and how we could accomplish those things. So we did come up with some very small things that we could do that were very simple to implement. We wanted to take down part of our barriers for our kids who were online, who perhaps weren't comfortable having their cameras on in their homes for a variety of cultural or personal reasons. So we were able to create a background for the school district of La Crosse that let every student turn on just a virtual background that put them all on the same level. So we were also able to redo some of our menus and how we are, sorry, I'm just stumbling tonight in my words, so I apologize. So how could we better represent our diversity in our district through our menus? So we were able to add some of our some things that are Hmong dishes and some soul food to the menu. And we were able to do that this past school year. So those were really exciting things that were very low cost, high impact things that we were able to start in our district. Last year, we also started a learning platform called Positive Foundations. As you know, our first year we were virtual pretty much the whole school year. So we needed to offer some classes that could be virtually done, and that eliminated some of our barriers for people who didn't have transportation or childcare to be able to attend some of those classes. We did some love and logic classes. We did some like cooking and baking and decorating classes. We were able to do art classes. So it was just a really fun time for families to be able to either participate just as parents or as entire family units. So that was really neat. We also had a bedtime stories series that was read by local and state leaders. So we were able to have like our mayor and members of our fire department read some of those stories, but we also had our lieutenant governor, part of our LGBTQ community. It was really important that everyone feel like they were seen and represented. So we really did have a really great response to that. And what started in being a sort of just a few weeks project sort of became a semester long project. So it was really neat to see that kind of unfold, and our families were able to just participate by reading bedtime stories with their kids. So it was kind of fun. Currently working on a few things. Tracy and I were looking at some opportunities in the beginning of this school year and how we could take our biggest group of untapped resources, our retiring baby boomer crowd, and how could we integrate them into being volunteers in our school districts to help some of our kids. So Tracy found out about a program called Foster Grandparents through Workforce Connections here in La Crosse. And we were able to partner with them in order to both recruit more foster grandparents for their programs. And Tracy's able to also be able to teach them about our social and emotional learning platform that we started this year, and how they can help those kids to do and expand their own social emotional learning. We did a lot of quantitative interviews this year. I interviewed roughly 50 families from our schools with the biggest diverse populations, got a lot of feedback and information about what we can improve on with our communication and what things would be helpful for parents to know and in what forms. So that just kind of hits on the highlights there. But we're hoping this year, there's been a lot of groundwork laid to do a pilot project starting in the fall with our community schools. And that is a parent teacher home visitation project, which started about 20 years ago in Sacramento, when families were feeling as though the district did not communicate well with those families. and what they could do to help improve that situation. So that has sort of spread throughout the country over the last 20 years. And we're excited to be able to look at how it can impact some of our families and our staff here in making parents more partners in our educational system than just spectators or bystanders. So some of that might have to do with teaching parents how they can help with their children's schoolwork and education. And the other part is helping teachers to go in and learn some of our cultures of some of our other families and educating them on how they can be helpful both at home and with students. And finally, our future work, which we're excited about for next year, rather than operating on that whole district level, kind of bringing it down to more of those building levels. How do we integrate into more of our disparate communities, our communities of color, our communities living in poverty, and how can we help to bridge some of those maybe traumas in the past that have taken place and move forward in partnership with each other? Can we perhaps look at having some of our targeted classes in our Positive Foundations platform for our non-English speaking families? How do they navigate the parent portal? How do they navigate through our Canvas where our kids' homework assignments and lessons live? How do they go through Infinite Campus, but some of those websites that we have as a school district, and where to find some of that information if they're non-English speaking families? And how can we make sure that we have that information provided in other languages as well? We also want to educate more of our staff on the cultural norms and some of the microaggressions that could be taking place in our classrooms, and being able to update them on some of those things that we might not be educated about on the school district side. And we also want to build some of those welcoming environments in each building to let families know that we want everyone to be seen and represented in each of their buildings. So how do we build a really welcoming, positive environment in our buildings to welcome people from all over our community? So that's just some of the stuff we're working on in family engagement and making sure we can partner better with our families that we serve. So does anybody have questions about any of those initiatives? Yes, sir.
I have a question about, like, how do you find out about the trauma? Is this something that comes out from the survey, or are these children sharing that, or are you just assuming some trauma? Where are you getting the information from? What type of way?
So I know Barbara and Tara are going to talk to a lot more about some of our screening tools we'll be using to help identify some of those things. And just speaking from a global perspective of the past 2 years and the trauma we've all been through, there is a lot of trauma that our kids and our staff and our community still is going through from the pandemic. So just looking at it from the perspective of how can we address kids and their needs always from that trauma perspective, and moving forward with interventions that can be helpful for that. And if these guys don't talk about it more, we can definitely dive into that more towards the end if they haven't answered some of your questions. And I think Helen, you had a question as well.
Yeah, I do, and probably it follows like what the judge was talking about. When you were sat down with the round table, how did you identify the families that you were, going to be meeting with at that time? And my concern is, some of the trauma in the families, the dysfunctional families, how do you engage them? Because, that's really very difficult. And in my practice over the last, probably the last 40 years, but in the last 10 years or so, things are much, more difficult all the way around in trying to, provide services for kids and their families. It's great when you have parents that want to be involved, but there are so many parents that are not involved. How do you get them involved, and how do you work with them? Those are the kids that I see a lot, and they wind up in the system somehow. And quite frankly, I've been really unsuccessful in being able to figure out a solution to this. You talked about microaggression in the classroom. I've heard countless stories of bullying and harassing of students, and just parents that just don't want to work together. So how do you do all that?
Well, I'll back up and
It's a
start
great
with the round
program
table.
for you.
No, it's perfect. Let me go back to the first question you had about the round table and how we
Okay.
chose people. I wanted to make sure everyone at the table was represented. So we did have some administrators and school staff who wanted to take part, teachers who were looking to build bridges in the community and learn more about how they could celebrate diversity better in their classrooms. But we made sure to invite people from our BIPOC community, so our Black, Indigenous, people of color. So there were people from the Latino, the Hmong community. There were people from our LGBTQ community. We included some of our neighborhood supports like the YMCA and the Boys and Girls Club. Am I forgetting people? Families with, there were families represented with children of color and different cultures and backgrounds as well. So we kind of went through a pretty exhaustive list to make sure everybody was represented at the table. And I kind of like this discussion, let them lead it where we wanted to go. We started with an agenda, but the discussion sort of led into other issues that have happened in the past and how we could just build a more somewhere with a lot more equity rather than equality. It's not quite the same. And how do we clarify those? How do we get families involved who stereotypically are not involved? That's a really good question. Doing it during the pandemic was tricky.
Can I?
Yeah, please,
Can I,
Tracy, throw in.
Sure. I think, I don't know if this is what you're looking for, but I think part of Steph's initial work in those roundtables, she had gone to every school and spoke with some folks at our different schools, and then asked for a potential list of names for people who would be willing to participate. And then she proceeded to reach out to those folks and then engage them and again invite them to these roundtable experiences. So that's sort of how the original list of folks was obtained. In goal 4, and I know one of the challenges with our project is each one of our goals overlaps another goal. In putting together this presentation, I was a little I had a few questions for myself in putting it together. In goal 4, we're going to talk a little bit about our prevention audit, which is where our project began in 2019. But the prevention audit was sort of a massive needs assessment, and every school went through that process when they joined and began working with Project Where. And so lots of data was collected, and the tools that were used were from evidence-based sources. And I'll speak more about that in goal 4, but I don't want to take up any more of Steph's.
No problem. And it is always a key to try and find out how do we access information from groups of people who are normally underrepresented. That was a big reason I did the qualitative interviewing rather than just sending out a survey. We know that it tends to be the same people who fill out the surveys because people who don't feel heard in the past haven't felt validated in their views. So I really wanted to interview families and talk to them more in depth. A big route that I'm trying to do is how do we build bridges by building relationships? So I've really tried to get into some of our women's groups, our Better Together groups in the area. Can I reach out to parents and families of underserved kids, and where can I find them? Where can we go to meet our families? So this summer we'll be doing a lot of work in going out to our Hmong community through either some of our community gardens, some of our farmers markets, going to the Hmong Cultural Center and being able to talk with families there as well. So I think being able to find where some of our families are at and going into the community to build those relationships is how we will be able to kind of repair some of those traumas and those relationships. Helen, I know you had a question as well about how we measure success or the lack of it. A lot of that's been kind of subjective at this time. We took those surveys that Tracy talked about at the beginning of my first year, and we have those qualitative interviews we did this year. We were able to measure some success of our platforms by how many people engaged last year, both in the virtual classes and in the bedtime stories. We were able to measure those through clicks through our communications folks. So other than that, we'll be looking at next year at the end of the year, redoing some of those qualitative interviews and seeing if parents have different perceptions about how they're partnering and how they're accepted into the district. So I hope that answered those questions.
Are we ready to move on to goal 3, or would you like to hear, does anybody have another question for Steph?
All right, great. So, and with that, I will pass off to Barbara Eisenmenger and Tara Allert with our Student Family Assistance Program.
All right, thanks, Steph. Good evening, everyone. I'm Barbara Eisenmenger. I am a pediatric behavioral health provider at Gunderson Health System. And so this portion of our presentation tonight, my colleague Tara and I will talk with you a little bit about Student Family Assistance Program, or SFAP is the acronym.
And I am Tara Allert. I am a clinical therapist also with Gunderson and the SFAP new program that we have in its pilot year here as part of Project Aware. So we're talking about SFAP as it relates to goal 3 for Project Aware, but really SFAP kind of hits a variety of the goals like Tracy was talking about.
Ladies, excuse me, but could you, Tara and Barbara, unmute, because it's kind of, it's hard to hear both of you.
Yep. 1 second, just let me get to. Trying if I can get to a microphone.
You gotta go on. Scroll over your name.
1 sec.
All right.
Helen, is that any better?
No, Trey.
Helen, is that any better? Can you
That's
hear us?
better. Yes.
Maybe just give them your computer.
Sorry, we're all in the same space, so we're trying to make sure that we can maximize sound efficiency.
We're just going to adjust and take Steph's computer, and then we'll pick back up. Goal 3. I just need to unmute her. Oh, she is unmuted.
Okay, how is that? Starting over. Thumbs up. Are we okay?
That's better.
Okay, perfect. Thanks for your patience, everyone. We're all in the same shared space. So we were trying very hard to minimize any echo reverberations or anything like that. So we will start from the beginning. Thanks for your patience. I'm Barbara Eisenmenger. I'm a pediatric therapist at Gunderson Health System. I'm in the Department of Behavioral Health. And so the program that Tara and I will be talking with you about tonight is the Student Family Assistance Program. SFAP is the short acronym. So we will use that frequently as we talk about our program. And this portion of Project Aware, and the grant that was given to the school district really provided an opportunity for the district to join in partnership with Gunderson Health System, and really focused on how do we find ways to provide therapeutic supports to students within the context of the school day. So that's what Tara and I will talk with you a little bit about tonight.
Yeah, thanks for your patience as we navigated that sound. But I'll just repeat myself a little bit. My name's Tara Allert. I'm a clinical therapist with Gunderson. And like Barbara said, we'll just talk a little bit about our program, how it fits with Goal 3, but also just overall how it fits within the purpose of Project Aware. And really, I'm going to start with the middle point on this slide, but SFAP is intended to be an EAP model of care embedded in the schools for students and families. And so really looking at providing short-term preventative care for students and families at no cost to students and families. Barbara is the provider at the elementary level, and I'm the provider at the secondary level. So I'm at the middle schools and high schools, and Barbara's at the elementary schools. And initially with the development of SFAP, we're in our pilot year right now, but SFAP had been in the works for a while through Project Aware. And there were kind of 3 prongs of what SFAP would focus on. And one of those is that one-on-one individual support of students, short-term counseling, or mental health interventions. The second being supporting professional development for staff. And then the third being supporting parent outreach and education.
Mm-hmm. And as Tara mentioned previously, really when we're looking at, providing short-term preventative care supports within the school system, we're really looking at how do we meet students where they're at when needs are just starting to emerge, so that ideally we're able to really build a positive skill set and a set of positive resiliency factors, not only with students, but also their parents and caregivers, and also in that wraparound team of school staff, building administrators, so that we're able to provide kids with the support and the skills that they need early on, so that ideally we're able to prevent significant mental health crises from occurring more frequently as students get older, and understandably, navigate through additional stressors and transitions as they continue through their school career. So because it is the pilot year, we're actually just coming up on kind of the end of year 1 of SFAP. The bulk of our work this year really focused initially on identifying a succinct referral workflow. So where are students coming from? How are they identified? And how are they connected to the program? And certainly a big part of that was building significant relationships with our referral sources in each school building. So for us, referral sources tend to really be student services staff members, so social workers, counselors, and then we have also had a small number of parent or caregiver referrals as well. So we really spent a significant portion of the summer months this past summer, as well as the beginning of the school year, really building those relationships, spending time in each school building. Understandably, we do have a large number of buildings in this district, so it was really important for Tara and I to be able to really kind of soak up the culture of each building and figure out, how are students supported, what supports are currently in place, and how can we really team effectively and supportively with staff members who already know these students particularly well. So what we've kind of discovered throughout this past first year is that a lot of the students who have come to us for short-term support really are coming with a set of presenting needs and concerns that clinically, based on, our skills and expertise in our area of licensure, really do warrant long-term outpatient care. And so certainly a large portion of our work this year has been doing a lot of teaming with community behavioral health providers, as well as colleagues within the behavioral health department at Gunderson, to make sure that kids are able to successfully transition to a longer-term model of care with a provider, if that is in fact what's needed, and what we've talked about with family and student as really being medically necessary. We also, though, have had a fair number of highlights and I think really great moments of success and kind of positive feedback as we really reflect on this past year. So Tara, if you want to talk a little bit more about highlights, it's been fun to kind of reflect in preparation for tonight on some of the things that have been really supportive and positive throughout this pilot year.
Yeah, so Barbara has been in her position throughout this school year, and I've been in the position at the secondary level really just for the second part of this school year. But as we reflect back on the pilot year of SFAP, that I've had a number of student successes, and I know Barbara has too, student successes at the elementary level. But really the collaboration with student services teams and building staff, building admin has been wonderful, and just the overall partnership between Gunderson and the school district, I think on a number of occasions has allowed for increased access to care and support for students and families, whether that's through mine and Barbara's direct support within the district or bridging to more long-term support like Barbara was mentioning before. And I don't think it's surprising to any of us, given the impact of COVID and the pandemic, that we are seeing like that higher presenting needs for long-term supports. We do have some flexibility within our program where we're able to do, it's intended for that really short-term model of care, but we are able to extend beyond that to provide care as needed for families. And I think that's been a huge success of the program, is just ease of access and why we've seen so many referrals to our program, because we're right there in the building. There's no cost to students or families for our supports, and we're in the buildings consistently. And so we've developed those really solid relationships with school staff.
And I think in addition to, thinking about certainly financial burden and cost being a significant barrier for some families, I think also not having to worry about the transportation piece. I know for a lot of parents and caregivers working from home during COVID or having COVID themselves or ill children, certainly there was that piece of, wow, like, I don't know that I have any more vacation time or PTO, or certainly parents and caregivers where PTO or sick days aren't an option, right? So I think being able to be housed within each school building and provide kids those therapy supports during the school day has absolutely been a huge benefit. And so moving ahead, we're talking a little bit just about kind of data in terms of referral numbers. At this point in time, I'll talk about the elementary level, and then Tara respectively will talk about her experiences in terms of data at the secondary level. But looking back throughout the entirety of the school year, although we did cap our referrals in terms of not taking any additional referrals beginning of spring, just to make sure that we had ample time to do a thorough assessment and provide thorough care up through that intake appointment until that discharge appointment with students. We wanted to make sure clinically we had enough time to assess needs, provide appropriate interventions, do care coordination with appropriate players, and then discharge or come up with a plan for long-term care before the end of the school year, which understandably is very quickly approaching. So at the elementary level, we had 73 total referrals dating back to the beginning of the year. And as of the beginning of May, there are 45 students currently still receiving active care. Now that we're into mid to late May, that number is a little bit lower. I have discharged a couple of students. I think we're closer to about 39 active students at this point in time, but still certainly a high number of students referred our way at the elementary level throughout the entirety of the school year. And so in terms of needs that we're seeing at the time of referral and the time that care is initiated. At the elementary level, seeing particularly at the beginning of the year, pretty significant separation anxiety, some behavioral difficulties, a pretty significant need for development of regulation skills, and not necessarily regulation skills in what we would think about as like age appropriate terms, because I think we've also seen with COVID certainly a pretty significant gap in kind of chronological age compared with where kids are really at developmentally. So thinking about it in more of a relational developmental context, certainly referrals with grief and loss related concerns, adjustment related concerns. So it could be, a family is having some changes to residency, maybe they've had a new baby at home, maybe there's been a change in parental relationship or caregiving responsibilities, those sorts of things, providing behavioral supports for students with diagnosed attention concentration concerns, and then also mood concerns. So looking at things along the lines of if we're seeing, you know, an increase in withdrawal, depressive symptoms, isolation, those sorts of things.
Yeah, and at the secondary level, we have had 62, and actually this is probably since we completed this, I think 63 or 64 referrals, if we count some referrals that have come in toward the end of the year for consultation. But 45 students who were actively receiving care as of beginning of May, again, probably like closer to that 37, 38 number of active students currently. And presenting needs that really parallel what we're seeing, some of what we're seeing at the elementary level, but some of the presenting concerns that are more specific to secondary level. So middle school, high school is school avoidance, or in some cases, school refusal and suicidal ideation, an increase in that at the secondary level.
So we won't necessarily jump super thoroughly into data overview for year one. Certainly this presentation is something you all will have access to. So we would certainly be happy to answer additional questions as you have a chance to review it. But we did give basically a rundown of total students open to SFAP, combination of those numbers at the elementary and secondary level, some, you know, hard outcomes in terms of students who have already been discharged, what kind of that long-term plan looked like for them. And then also essentially kind of an elaboration of here's where care stands at this point in time. And if we can make a prediction in terms of what that will look like at discharge when the school year concludes, that's kind of our best estimate of what those numbers will look like. As we mentioned before, at this point in time, there was, I think initially probably a higher number or a higher percentage of students who did end up with a connection to outpatient care than I think what was maybe hypothesized when the program was first developed, and those conversations were initiated between the school district of La Crosse and Gunderson Health System. But again, I do think we're all very aware of the significant mental health needs that students are presenting with. And I think certainly those needs being pretty significantly exacerbated by COVID-19, I think is a good indicator into why we're seeing some of the outcomes that we are.
Mm-hmm. Yeah, so quick overview of this table, and then if anybody has specific questions about this table or anything related to SFAP, feel welcome to ask those questions. But looking at those total referrals, we've had 135 total referrals, with elementary being kind of up and running the whole school year and secondary being up and running for the second half of the school year. And I think that really just speaks to student need, and that if we have an easy access for a referral pathway, that will be utilized to get students connected to support. And I think a huge benefit of the collaboration with Gunderson has been being able to get students more quickly connected to those long-term supports or ongoing outpatient support if needed after the course of care through SFAP as well, just with being embedded within the Gunderson system and familiar with collaborating with the Gunderson staff as well.
And so when we think about future planning for the program, certainly understanding that this really was a pilot, we weren't exactly sure what we would find in terms of referrals, what we would see in terms of need, and really what the response would be. Tara and I have a needs assessment put out to our referral sources, so the social workers and the counselors, as well as an additional needs assessment put out to building administrators as well, just to really help us inform ongoing professional development needs and responsibilities, things that we can help support within the building, and also really looking at what things worked really well, what areas can we improve upon, and just making sure that we can really continue that collaboration so that we can best support students with the needs that they're coming to school with every day. And so we're hoping to really inform planning for this coming summer as well as the next 2 school years based on some of that data that will come back to us from the needs assessment. We also really are hoping to use some of that data to plan significantly for parent outreach and education, and also thinking about how we kind of best inform either interventions or focus groups related to specific skills based on what we're hearing from parents in terms of feedback. What things are they wanting more information on, so that we can really inform the supports that we provide based on what families are experiencing on a day-to-day basis.
And Alice, going back to the question that you asked earlier, both the needs assessment, but embedded in the needs assessment, we have some outcome questions as well. And so really taking a look at like what's worked well this year with SFAP and the collaboration with student services, and where are the areas for growth. And so doing that, annual check-in, whether that be with, needs assessments in the future or outcome surveys, to continue to use the data to inform our future planning and changes. And utilizing some existing data for that planning for parent education and outreach. Some of that, which Steph was talking about earlier, the qualitative data that she gathered in those parent interviews. But also, Tracy, I'm not sure if you'll talk maybe a little bit about it, but some of the mental health screening that we've done too, kind of looking at global themes of student needs and presenting concerns to inform what might be most impactful for parent education and outreach.
What other questions do listeners have for us tonight as far as SFAP and our experiences this year, themes we've identified, future planning, anything we haven't addressed yet already?
I'm wondering how many students you may not be catching through your work to try to bring them into the program that might be suffering, and you discover later. And then what do you do with students like that to try to get them into this mindset, I guess?
I can speak a little bit to that question, at least on the secondary level. SFAP was designed to be this short-term preventative model, but certainly we know post or, in the midst still of the pandemic, that a lot of students may need more support than that. So SFAP, I think, has found a role to support those students that really do meet like that ideal short-term preventative care or early intervention support. And I've had a number of those referrals at the secondary level, but I've also worked as a bridge to longer term support for a number of students at the secondary level too. And really what that's looked like, and this connects to what Helen was asking about earlier, is like a lot of motivational interviewing, a lot of like dedicated time of working with families, and a lot of care coordination with families and with student services teams and with other levels of community support too, whether that might be systems of care or CCS, CPS, just really looking at how do we wrap around lots of services around this family, what are the needs, and how do we get the families the support that might be most helpful. But those are certainly the cases that there's just ongoing work to be done in supporting those families, and ongoing work to make sure that we're not missing students. And so I think that's been a really great way of collaborating with Gunderson and being embedded in Gunderson systems too, because we were able to see, they have this follow-up schedule and they attended this follow-up appointment, or were able to collaborate with their PCP and see, what happened in that med check. And so that's been really a wonderful part of, being a part of Gunderson system and being a part of the school district system. And another layer to that, I do think, is going to be future rollout of mental health screening that we're going to be doing, because we have found in those meetings that sometimes we are catching students where it's like, oh, we weren't really identifying them in these traditional ways that we think that we have, that we have to identify students. But in doing some of the screenings that we're doing, we're able to just have another layer of making sure that we're capturing all student needs.
Yeah, we had another question about waiting times to be seen by a therapist. And I just wanted to clarify, are you referring to either support facilitated by myself or Tara, or an outpatient Gunderson therapist, or waiting time for a community therapy provider?
I don't know how to answer that, other than that I'm a part of the Better Together Steering Committee, and I hear that the waiting time can be anywhere from 6 to 8 weeks to get to be seen.
Yeah,
And I don't know what that means, other than that seems like an extraordinarily long time.
Yeah.
If a kid
yeah,
is in trouble.
absolutely. Yeah. And I think particularly, when you're a parent and you have a student who's struggling or in crisis, absolutely. I mean, I think that is an excruciating thing to have to experience, right? And so one thing that Tara and I have been able to do, at least at the building level, is we are typically able to connect with kids pretty rapidly after referrals come in, and we actually don't have that on our outcome data at the present time, but it is something that the Department of Population Health at UW-Madison has been tracking for us. And I think typically kind of overall average was around, I think the last I saw it was around 2 weeks from the time a referral was received to that time of intake. And so certainly it's not necessarily same day or next day appointment. But I think if we're looking at, for both of us being able to kind of be a bridge and more of an immediate support or resource for kids and families while they wait to get connected to that long-term therapy provider, I think that's also been a pretty significant success of the program too. And being able to make sure that during the school day, as kids wait to get in with an outpatient therapist, either at Gunderson or in the community, we're still able to work on some of that skills-based work to manage symptoms and to talk with parents or caregivers at home about ways they can be a support. We're able to start to really implement some initial interventions, whether it's around mood management, doing some safety planning if there are concerns around self-harm, suicidal ideation, anxiety management techniques, and even kind of helping kids feel supported to have an additional adult during the school day that they can go to. So I think we have been able to do some of that initial bridging work, but I absolutely hear you. I think that access piece in terms of long-term supports is a really significant challenge for lots of kids and families.
Mhm. Yeah, at the secondary level, there have been a number of referrals that I've received that maybe they actually already had an appointment scheduled out with an outpatient provider when I received the referral, but it's not, it's a number of months away and they're wanting just some short-term immediate support, maybe some targeted work related to specific school concerns or support. And so at the secondary level for SFAP, at least in our third quarter, I think the average number of days from date we received the referral to date of intake was about 11 days. So we really are able to, increase access to care quickly through SFAP. And just access to community support has varied so much in my experience just across this last semester. Community providers have varying wait lists, but I've had some patients have good success getting into Gunderson, some patients that have had appointments at Mayo where I maybe just provide some supportive bridge work or care until they get in. But certainly overall in our community and nationally, that access to care is such a struggle.
Thank you, but that's encouraging what you're doing.
And one more
Thank you.
question
Yeah,
here.
yeah.
Now, Alice wrote her book about destigmatizing mental illness that she talked about at the beginning. And the school district's been working for quite a number of years now on mental health. And are you seeing less stigma at this point than maybe you would have quite a number of years ago with children? Or what can you say about that?
That's a really good question. I think I can certainly speak to, at least at the elementary level, I do think there's been a lot of really thoughtful intentionality on trying to normalize pretty significantly the experiences that we all have as humans, right? Either experiencing periods of anxiety, periods of low mood. I think, the conversations around really trying to think about caring for ourselves when it comes to our mental health and well-being in the same way that we think about, particularly with young kids, emphasizing we want to make sure that we get adequate sleep. We want to make sure that we're eating a variety of well-balanced foods. We want to make sure that we're taking care of our physical health. I know at least at the elementary level, and even in my work in other facets of kind of my clinical role, you know, infants and young children too, really kind of being able to hold both of those. And I do think there has been significant progress around even just hearing elementary kids talk to one another around like, oh, yeah, they're having a hard time with that. I worry about those things too. I think kids are really starting to kind of normalize and internalize like this is part of life and this is what I can do when hard things feel really big and I need more support. So I do think that there has been, particularly at the universal level, at the classroom level, at the elementary level, lots of conversations around how do we kind of integrate mental health and conversations about mental health into day-to-day life. And I think just really kind of commonplace day-to-day interactions. And so I think certainly those conversations are also really important for parents and caregivers to carry over at home too. And we also know there are a lot of different reasons, whether it's family of origin, whether, you know, there's a cultural component, right, to when mental health is discussed and when it isn't. But I would say, at least at the elementary level, I've definitely seen some really positive gains. And that's just not necessarily only within school district of La Crosse. I've worked in a variety of other districts and in other settings too. And that's also been a common theme that I've seen. Again, I can't speak for, you know, the adult population or the adolescent population, but in terms of my work with young kids, I do see really positive progress happening there, which is great.
Yeah, I would say I would echo some of seeing some really positive progress at the secondary level too, where we just have some really strong advocates in the district. We have adults in the building that are strong advocates for supporting youth mental health. And we also have so many student advocates for normalizing those conversations. And so I do see us moving in the right direction as it relates to stigma. And I know Tracy has later another conversation with you all around SEL or social emotional learning. And so I think that is a piece to that, as well as, you know, our adult SEL and our student SEL curriculum and how that ties into mitigating stigma and increasing help-seeking behaviors. And I know we had another question. I didn't.
Yeah, I think Tracy, it looks like you just responded in terms of
Yes.
peer support groups for
Yep.
teens. Okay. All right. So I am going to transition to the next slide. I'm going to turn it back to Tracy on goal 4 and hand Steph's laptop back to her. So if you see a little bit of a shuffle and some office space in the background, that's what's going on. Thank you all for your great questions and your attention tonight. Thanks for the opportunity to share about our program with you.
Yes.
Thank you, Tara.
Can folks hear me? Yes. Okay, so I'm curious. I'm happy to continue our conversation. I'm just conscious of time. And I don't know if everybody needs to leave at 7 because technically I think we're at that point of time.
You can keep
So,
going if you would like.
Okay.
We'll record this. If someone has to leave, they can watch it later.
okay, yeah. Okay, great to know. Thank you. So our 4th goal has to do with increasing access to and engaging youth in mental wellness resources. So here is, and again, please know that all of this is working together, right? From prevention through services. And this is a really large project. So some of you might be familiar with mental health first aid. And at the beginning of the project, Project Aware, one of the Project Aware, an expectation from DPI was to have 80% of our secondary staff trained in youth mental health first aid. That became a challenge, though. We recognized that, and this is before the pandemic, that financially and the way the program was implemented, we had to have specific trainers. They were keeping audience participation at 20. members. And so it would take us a very long time and it wasn't practical. We did get the DPI to support that we were going to be working on mental health literacy throughout the entire district and raise the level of mental health literacy. So many of you might be familiar with mental health literacy, even though it's the term mental health literacy has been around for 10 or 15 years. But there are basically 4 pillars or 4 elements of mental health literacy. That one is, what is mental health and how is it maintained? So the wellness, the mental health promotion side. The second pillar is, what is mental illness and how is it treated using evidence-based modalities and methods. And then, as we were just talking about, what is mental health stigma and how do we reduce it? And then finally, how do we increase help-seeking behavior of our students and staff? When people are not in healthy places, how can we support the awareness of that and then people getting assistance when needed? So those are the elements of mental health literacy. And at the beginning of Project Aware, and this actually I think might have been an idea that Kurt Teff got from Better Together, but the idea was to establish in every school a resilience champion that would lead Project Aware activities. Now, in addition to, well, as a part of that, every school was to identify a team, hopefully anywhere from 5 to 12 members, and get a variety of stakeholders. We encourage schools to consider including a parent on their team and a student if they were in secondary level. Every school was to conduct a prevention audit, or some of you might be familiar with the concept of a needs assessment, but it basically, we looked at 6 data points and we surveyed students, we surveyed staff, we surveyed families. We used some tools from the University of Maryland, the National Center for School Mental Health. They have a lot of wonderful tools. And so there was this multifaceted data gathering at the beginning of Project Aware. And then teams were to develop 3 to 5 goals that would get included in the school improvement plans. And we requested that one of the 3 to 5 goals be a prevention focused goal and one be a service goal. Now, you could have 3 prevention goals if you wanted, but you had to have at least one, because again, we're trying to improve the spectrum of mental health from prevention through services. And then these teams were supposed to be meeting monthly and working on implementing their goals. The expectation is that every year teams will review some important data points and then adjust goals as appropriate. Now, it's my understanding that I get to come back to this group of folks and present on social emotional learning in 2 weeks. And social emotional learning, it has been a huge strategy that we have been trying to implement school-wide, really beginning this year. And so I'll be chatting with you all about that and explaining what school-wide social emotional learning is. Most of you are familiar with some aspects of social emotional learning, but we'll talk more about that in a couple of weeks. And Steph, if you can go to the next. We have many examples, but we knew we were probably going to be short on time. And so I just shared one example of some high school work. Logan High School has done a lot of work. They joined Project Aware at the very beginning. And they have done some mental health advocacy campaigns. And last spring, for May, Mental Health Awareness Month, they did a school-wide mental health awareness campaign. With Project Aware dollars, the staff were able to get t-shirts, matching t-shirts that talked about mental health matters. And then there were morning announcements that addressed mental health issues. And that was just one example. Logan High School also put together a really neat little website attached to their main website for mental health promotion, and everything from like virtual calm rooms to ideas for using nature to help you relax. And so just wanted to highlight a couple of examples from Logan High. And then at a district level, you've heard all of us tonight share district initiatives, but there's another initiative that we were able to get off the ground this year, and that is our Cooley Bridges. It serves as our mental health resource website, and it is available if you were to Google Cooley Bridges, excuse me, School District of La Crosse. So I'm gonna let.
Oh, yep.
Oh, sorry.
No problem. We do have that Cooley Bridges, and I think it's CooleyBridges.org. And we have not necessarily pushed that out yet in a super formal capacity. We are still building that, both the referral pathways link and to add information and resources as we continue to move along that front as well. So we are doing some of that, and I'm sorry, my video was not on, but that website will be kind of built out through the next couple of years to add more and more things, including to go back to kind of Helen's question there about how long people are waiting. Parents will be able to access the provider, and if they have direct openings right away. So we think that'll be really helpful. So we're currently building under that Cooley Bridges website. So please keep in mind, if you're looking at it, that it is being built out and expanded on throughout the next year or two. And I think Tracy is back from
my little cough attack. Sorry, apologize. I think we're ready to go to the next slide, which just basically ends our presentation, and it shares links to our some of the major organizations that we've been using.
Sorry,
as, excuse me, as we do our work. Any questions? And I apologize.
Tracy's got really some very, very good options up here if you guys are looking for more information as well. Some of these are really, really helpful. And I know the MHTTC has been really helpful for me in doing my job as well. So these are really great resources that you'll have at your disposal when the time comes. Anybody else have any questions while we wrap up? And I apologize for my technical issues. This is not my strong suit. So I apologize, and thank you again for your patience. We appreciate it.
I think you did very well.
How's
Really appreciate
how's the mental health of the teachers and the staff?
We're working. I'll be honest with you. I felt like personally, both as a parent and as an employee of a district, I felt like even as a human, I wasn't prepared for this school year to be as rough as it was. We all had this sort of thought, I think, that we were going to go back to normal, and enough of my life experiences have made me realize that, there is no ever going back. We've started a new normal, and we just need to figure out how to work well within it. So we're working on it, and we're getting there. And I think the more help that we get from community, and the more we talk about mental health, I think this was I think Tracy might agree, this was a really It's a really good time for this project to come up while we're in the middle of that pandemic, and how we can talk about mental health just more openly because of the pandemic. So I think that's been helpful as well. And you had one more question, Helen?
Yeah, thank you. I want to thank all of you for the great presentation. Even though I'm, live in the school district, don't have any current children or nieces or nephews in the school district. So I don't know about this, and I'm wondering how many other people don't know about this. But I do work with a lot of families who have kids in the school district, and I don't know that they know about this either, based upon the issues that they're having with their kiddos. So I think that, more people who are working with families need to listen to this presentation. And I'm thinking of like lawyers who are working with family law cases, who are working with kids in juvenile delinquency, who are working with kids in the CHIP system, who are guardian ad litems, domestic abuse organizations. Everybody needs to have this presentation, because there is a wealth of information that we just don't know. And I think we need to have these people know this information in order to be able to help the people that we're working with. So thank you for being here tonight. This will be on our website, and I hope other people will tune in and, review it. But certainly I would like to, maybe next fall, and the Bar Association meets weekly during the year, but I think we're done for this year. But I think I'm going to recommend that they reach out to you guys and get some sort of, presentation on their agenda for next year, because they ought to be knowing about these things. And, you're free to, write something, send it to us. Let us know when you're having sessions. Because I certainly would like to get the word out. This is a fantastic program and something that's really critically needed.
Sure.
And I hope
And
that
I'll
we
have
can
Tracy make sure that she has her email in the chat, so you can pass that out. As a grant coordinator, Tracy's
Right.
probably the best touch person for that.
Right.
And anybody, I'm certainly willing to come and chat with anybody who wants that. I know we have started some conversations in some of those county programs. I know we've talked about mental health in the probation system and in the CPS system, and some of those case managers are aware, but I think you brought up some really good points, and I think they would be some great opportunities for us to let people know more about what we're working on as well.
Thank you very much.
Well, I agree with that too. And I think Alice would agree that there's all these resources out there, but there's too little communication amongst the different resources and amongst the different groups. And that collaboration really needs to be increased. There's efforts at it, but it's still a long way to go to get that out there. And I think that also is going to help put mental health out in the forefront in the community as well. And that's going to help destigmatize it greatly. But I think it's really good that you're getting at these young kids in school with the teachers, really building that into their learning process. And all the people that are past school age, are the ones that are still holding that stigma too close. And I think we're going to bring a new generation forward here, and that's going to really have a big impact on that stigma going forward, and help get mental health on the forefront, mental illness more under control. So again, thank you so much.
And I do think that we're making some headway. The national headlines with celebrities who have struggled with their mental health has been very effective. And I think whoever asked the question about peer supports, I think you're going to see a lot of that coming down. We need that help. And I think that we can get to people a lot earlier in their mental health wellness experience if we can provide those peer supports early on, rather than waiting for situations to really get out of control. And I know Tracy had one more thing she wanted to add.
I just was wondering, I actually took care of it with Helen,
Oh,
who to
sorry.
send this to. No, you're fine. You're doing, thank you.
Yes. And Alice, I don't know if you guys can hear me, but your question about staff and teacher mental health is really insightful, because that really is, the foundation of how we support more globally and universally our students in the district. And so I'm sure Tracy will talk about adult SEL when she comes back, adult and student SEL, but really as, thinking as a community, not just about how we support access to mental health treatment, but how do we support those adults who are on the front lines providing day-to-day support to our youth. We really, I do think, need to shift into that community care idea and model of mental health, because that's so important. I can support students through SFAP. I
Sorry.
can support individual students in SFAP, or we can support groups of students through treatment. But they spend so many more hours in their classroom, their communities. And so really supporting adult mental health is the foundation to supporting students.
And I hope you guys can come to that, because Tracy's got really, really good information on it. She's really passionate about it, and she's really been doing this for a long time. So she's got some really, really great information. I think you guys will like that a lot. It's probably a lot more interesting than what I talked about. So
This was good. This was good. All right, well, thanks
thank you
again
for having
your
us again.
time, and congratulations on the progress in your program, and we really appreciated you taking the time to share this with you. So good luck
Anything else,
on that.
Tracy?
Stay safe, and next week we have trauma responses and the brain-body connection with Corey Kitt, and then the week after on our school district again on social and emotional learning. We'll see how that goes. All right, thank you, everyone. Have a good night.
Thank you so much. You have a great night.
Take care. Bye.
Thank you.